topic is Andrews' 6 keys to normal occlusion. Lawrence F. Andrews in 1972 outlined 6 keys to normal occlusion after studying models of 120 non-orthodontic patients with ideal occlusion and comparing them with the best 1150 finished orthodontic cases. Absence of one of the following 6 will predict defective or incomplete treatment result. They are molar interarch relationship, mesiodistal crown angulation, labiolingual crown inclination, absence of rotation, tight contact, and curve of spine. Molar interarch relationship. The mesiobuccal cusp of the upper first permanent molar will fall within the groove between the mesial and middle cusp of the lower first permanent molar, and the mesiolingual cusp of the upper first molar fell within the central fossa of the lower first molar. Mesiodistal crown angulation. Crown angulation refers to the angulation of the long axis of the crown, not to the entire teeth. The long axis of the crown for all the teeth except molar is the most prominent and innermost vertical portion of the labial or buccal surface of the crown, and for the molar crown is identified by the dominant vertical groove on the buccal surface of the crown. The gingival portion of the long axis of each crown was distal to the incisal portion, varying with the individual tooth type, is a positive angulation which is considered as a normal occlusion. Next is the labiolingual crown inclination. Refers to the buccolingual inclination of the long axis of the crown and the long axis of the entire tooth. It is determined by the resultant angle between the line perpendicular to the occlusal plane and one tangent to the middle of the labial or buccal clinical crown. The maxillary incisors exhibit positive crown inclination, while maxillary and mandibular posterior and mandibular incisors have a negative crown inclination. Fourth one is the absence of rotation. Normal occlusion is characterized by the absence of any rotation. Rotated posterior teeth occupy more space, while the rotated anteriors occupies less space in the dental arch. Fifth, tight contact. To consider an occlusion as normal, there should be tight contact between the adjacent teeth. Sixth, curve of spine. It is a natural curvature of the teeth that helps with biting or chewing. It is an anatomical curvature of the occlusal alignment of the teeth, beginning at the tip of the lower anteriors, following buccal cusp of premolars and molars, continuing to the anterior border of the rams. Deep curvosity resulting in crowding, while flat curvosity is most respective for normal occlusion, and reverse curvosity results in spacing. In addition to this, Bolton's ratio is added as the 7th key of occlusion. Bolton ratio is determined the ratio of the mesiodistal width of the maxillary teeth and the mandibular teeth using a formula.